Do you have an ingrown toenail? Have you ever wondered if the shape of your toenail is the reason that it's happening? Watch on to learn more. Hi, I'm Mark from Feetology Podiatrist Centre. Ingrown toenails are a big problem that we help patients like you with every day. So why have you got that ingrown toenail? Often the shape of the toenail is the culprit. What do I mean by the shape of the toenail? Well, as a podiatrist, I get to look at a lot of feet, and what we often find with our patients that have ingrown toenails is that their toenails aren't flat. We start to see that the nails are bent into all different shapes. But before I go into the different shapes, what is an ingrown toenail in the first place? An ingrown toenail occurs when the edge of the nail is pressing into the flesh. It could be at the tip of the toe, it could be at the base, or somewhere in the middle. It can appear red, swollen, pussy, and infected, or there might just be some pressure and you might just see some redness in the skin around that area, or in some cases, you may not even see any kind of redness or inflammation at all, but the toe is still just sore. So, why does this happen? So the reason why ingrown toenails start is because we end up with pressure in the corner of the nail. And this is often due to funny shapes of our toenails pressing in and causing problems there. So I want to run through what some of these shapes are like. So the first one is what we call your involuted toenail. So to draw a picture of that, looking down the toe, is we have this toenail plate that is really quite bent over, okay? Now, in a lot of cases, this nail is going to grow pretty happily without any problems, and the skin folds around that. But where we can run into trouble is if we go and cut that nail too short in the corner, or if we go and damage it and we tear the nail and tear a piece away of there. What happens is that nail is no longer holding the skin fold in place, and we end up with a new edge of the nail here growing forward. This can become embedded in that tissue because it's changed shape, okay? So that's the involuted toenail and how that can cause problems. Another shape that we often see is what we call the pincer nail. So the pincer nail is the involuted nail on steroids. It's going to wrap right around like that and can even curl back onto itself. And again, that's a nail that can grow out without any problems, but there is more risk of pinching occurring where it's pressing into the toe, okay? That is one of the more interesting shapes we get to see, and we have a few of our patients coming in with toes like that we have to help them with. The final shape is what I like to call the deep set toenail. So again, we're looking down the end of a very boxy looking toe, but the deep set toenail is actually set below the skin of the toe. So when we're actually looking at this one, we wouldn't be seeing the nail plate at all. It's actually sunken down. And as it grows forward, it's going to run into the tip of the toe there and cause us pain and problems. Okay, so they're the three that we see most commonly. Now, how do we treat these ingrown toenails? We need to get rid of the cause of the problem. So what we find is we need to trim a bit more of that nail away to create some space for that to settle down. And what we often find when we're doing that is there might actually be a spike of nail that's been sticking up in here because at home you've been trying to cut down there yourself and to clear it out, but you're not getting to the bottom of the nail and it's just breaking off. So when we get in and clear it out, there might be a spike in there that it's like a needle digging into your toe, and that starts infection and stuff happening. Now you'll remember in the beginning I was saying not all ingrown toenails are infected. They can also just be red or even just sore and not seeing any redness. That's because we're getting pressure from the nail up against the side of the skin, and that can cause irritation. Sometimes there'll be hard skin in here as well, callus, taking up space. So again, with these kind of patients, we're getting in, we're removing some nail, and we're removing some of that hard skin to take some pressure off that area. And believe it or not, a lot of the time here we do this pretty painlessly for the patient, but if we need to, we can always give an injection to numb the toe. So they're the different types of shapes of nails that we see and how we get in and treat them. Once the ingrown toenail has settled, we get a better idea of a long-term approach. It may need no further treatment, the new edge of the nail may need some assistance to grow out, or in some cases we may need to do a procedure to remove a piece of the nail permanently. Click on the link above to check out Sakina's video that covers this procedure in more detail. So the first step to getting over your ingrown toenail is to book an appointment with one of our podiatrists today. They'll start treatment to get you relief at your first appointment and then build a plan to prevent that problem ingrown toenail returning. Call Feetology Podiatry Centre on 3820-6326 or visit our website www.feetology.com.au/ingrown toenail to find out more and to book online.